Welcome everyone, I'm Gisela Teixido from the Marfan unit at Vall D'Hebran Hospital in Barcelona. I'm glad to present our work on aortic stiffness and hemodynamics in Loeys-Dietz syndrome by 4Dflow MRI. Loeys-Dietz and Marfan syndromes present progressive aortic dilation and an increased risk of aortic complications. However, aortic dissections have been observed with diameters below the thresholds defined for elective surgery. So other biomarkers different from aortic diameters are needed to complete the prediction of risk for aortic dissection. Thus, the main objective of the present study was to assess aortic flow and stiffness in Loeys-Dietz patients by 4Dflow MRI and compare these results with those of healthy volunteers and Marfan syndrome patients, with the final aim to obtain potential markers of disease in Loeys-Dietz syndrome that might help on the prediction of aortic risk. For this, we included 21 Loeys-Dietz patients and 43 healthy volunteers and 44 Marfan patients. A 4Dflow MRI study was acquired and aortic hemodynamics and stiffness were studied. First, a 3D segmentation of the thoracic aorta was obtained from the angiogram and anatomical regions were defined, as you can see in figure 1b. 20 equidistant planes of analysis were located between the sinotubular junction and the descending aorta at the level of the pulmonary artery bifurcation. You can see this at the left part of figure 1c. And pulse wave velocity as a marker of aortic stiffness was obtained for the ascending and the descending aorta. Aortic flow dynamics was studied by IRF, what is in plane rotational flow, and systolic flow reversal ratio, parameters that are related to vorticity and helicity of flow, respectively. Loeys-Dietz patients presented larger diameters at the sinus of Valsalva compared to healthy volunteers, but no differences were observed with respect to Marfan patients. Pulse wave velocity at descending and the descending aorta were higher in Loeys-Dietz patients compared to healthy volunteers, but no differences were found between Loeys-Dietz and Marfan patients. Loeys-Dietz patients had lower IRF at the distal ascending aorta and proximal descending aorta compared to healthy volunteers. However, no differences were found with respect to Marfan syndrome. Systolic flow reversal ratio at the proximal descending aorta was increased in Loeys-Dietz patients, mildly increased, compared to both healthy volunteers and Marfan syndrome patients. In conclusion, Loeys-Dietz patients showed decrease in plane rotational flow and abnormally high regional aortic stiffness compared to healthy controls, and similar hemodynamics and aortic stiffness with respect to Marfan patients. Thanks for your attention.